Good evening. This is All India Radio. I am Valsa Williams and with me is Vaibhav Jyotsna Srivastav with the evening news. Lines. Prime Minister Narendra Modi reviews India's response to COVID-19, increase in testing and number of beds discussed to handle the peak. Home Minister Amit Shah to meet Delhi Lieutenant Governor and Chief Minister tomorrow amidst rise in corona cases in the national capital. Loss of smell and taste added as new symptoms of coronavirus. Union Minister Smriti Irani says government is committed to welfare of the poor. And government launches Arogyapath, a web-based solution for healthcare supply chain. Prime Minister Narendra Modi held a detailed meeting with senior ministers and officials today to review India's response to the COVID-19 pandemic. The meeting reviewed the national level status and preparation in the context of the pandemic. It took stock of the situation in different states and union territories, including Delhi. The meeting was attended by the Home Minister, Health Minister, Principal Secretary to PM, Cabinet Secretary, Health Secretary, DG ICMR and other officials of the empowered groups. Dr. Vinod Paul, Niti Aayog member and convener of the Empowered Group of Medical Emergency Management Plan, made a detailed presentation on the current status and likely scenario of COVID-19 cases in the medium term. The members took note of the fact that out of the total cases in the country, 2/3 are from 5 states. In view of the challenges being faced by the large cities, it was discussed to augment testing, as well as the number of beds and services to effectively handle the peak surge of daily cases. The Prime Minister took cognizance of the recommendations of the Empowered Group on city and district-wise requirements of hospital and isolation beds. He instructed Health Ministry officials to undertake emergency planning in consultation with the states and union territories. The Prime Minister advised the Health Ministry to ensure suitable preparations in view of the start of the monsoon season. The present and emerging scenario of the COVID-19 disease in the capital and the projections for the next 2 months were discussed. The Prime Minister appreciated instances of outstanding work done by several states, districts and cities in containing and controlling the COVID-19 pandemic successfully. Home Minister Amit Shah will hold a meeting with Delhi Lieutenant Governor Anil Baijal and Chief Minister Arvind Kejriwal tomorrow to review the situation in the national capital regarding COVID-19. Mayors of municipal corporations of Delhi will also be attending the meeting. Union Health Minister Dr. Harshvardhan, members of State Disaster Management Authority, Director AIIMS Dr. Randeep Guleria and other senior officers will also be present in the meeting. The meeting comes in the wake of rising cases of COVID-19 in Delhi, which is the third highest in the country after Maharashtra and Tamil Nadu. The Supreme Court had pulled up the city government on the state of affairs in the hospitals. A report.
The dual meeting of the Home Minister slated for tomorrow holds high significance in the wake of rising cases in the national capital. Yesterday, Delhi Lieutenant Governor constituted an expert advisory committee to advise Delhi Disaster Management Authority on various aspects of COVID-19 management in the city. The committee will give advice on the challenges being faced in Delhi and suggest measures to ramp up medical infrastructure. It will also advise Disaster Management Authority on the integration of measures being taken by the various agencies for the effective mitigation of COVID-19. Director General of Indian Council of Medical Research, Director of AIIMS Delhi and Director NCDC are part of the committee. Meanwhile, Delhi Health Minister Satyendra Jain has also stressed on the need to relax the existing testing guidelines by ICMR so that more people can be tested. Anand Chaturvedi, AIR News, Delhi.
A total of 2,137 new confirmed cases of coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 36,824.
The central government today said that the recovery rate reached 49.94% in the country, and 1,54,330 people affected with coronavirus have been cured. During the last 24 hours, 7,135 people have recovered from this virus. Total active corona cases in the country is 1,45,779. The Health and Family Welfare Ministry said 11,458 new cases of COVID-19 have been reported in the last 24 hours, taking the total number of cases to 3,08,993 in the country. This is the highest spike in fresh cases in one day since the outbreak of coronavirus in the country. During the last 24 hours, 386 deaths have been registered, taking the nationwide toll to 8,884. With this, the case fatality rate reached at 2.87% in the country. Indian Council of Medical Research (ICMR) said that a total of 1,43,737 tests for coronavirus were conducted in the countries by the various laboratories in the last 24 hours. The Ministry of Health and Family Welfare has issued the Clinical Management Protocol for COVID-19 pandemic. Loss of smell and loss of taste are included as the new symptoms of coronavirus amongst others. Health Ministry suggested that investigational therapies and drugs, remdesivir, convalescent plasma therapy, tocilizumab and hydroxychloroquine should only be used in a defined subgroup of COVID patients. The Ministry advised that remdesivir may be considered in patients with moderate disease who are on oxygen. Convalescent plasma may be considered in patients with moderate disease whose oxygen requirement is progressively increasing despite the use of steroids. In the case of convalescent plasma therapy, it is advised that recipients should be closely monitored for several hours post-transfusion for any transfusion-related adverse events, and its use should be avoided in patients with IgA deficiency or immunoglobulin allergy. Health Ministry also suggested that the use of tocilizumab may be considered in patients with moderate disease with progressively increasing oxygen requirements and in mechanically ventilated patients not improving despite the use of steroids. On the use of hydroxychloroquine, the ministry said that this drug has demonstrated in vitro activity against coronavirus and was shown to be clinically beneficial with significant limitations. It is advised that this drug should be used as early as possible in the disease course to achieve any meaningful effects, and it should be avoided in patients with severe disease.
WHO Chief Scientist Dr. Soumya Swaminathan has said the coronavirus mutations are not expected to alter the vaccine efficacy. Speaking at a live question and answer broadcast on WHO's social media platforms yesterday, she said the testing for vaccines is underway. She added that while it is difficult to predict when a vaccine will be ready or whether the samples being tested will meet WHO criteria, as per optimistic estimates, a vaccine may be ready by the end of this year.
Now, there are two vaccines that are currently in the later stages of testing, phase 2, phase 3. So we are expecting some results by October, November, December of this year. Now, we cannot predict at this stage if either of those two vaccines is going to meet those standards that I talked about. But if we are hopeful and optimistic, yes, we could have the results at the end of the year, and we could also have some doses available. But the good thing is that we have another 8 or 10 candidates which are getting into human trials, and again, which will be in large-scale human trials by the end of this year.
Arogyapat, a web-based solution for the healthcare supply chain, was launched to serve manufacturers, suppliers and customers to effectively deal with the COVID-19 pandemic. This national healthcare supply chain portal will remove supply chain bottlenecks during the COVID-19 pandemic. The vision of this initiative is to set up an information management and forecasting database platform at the national level. It will capture demand and supply scenarios for key healthcare needs items. This public platform will help healthcare users like hospitals, pathology laboratories, research institutes, medical colleges and patients. It will also provide seamless access to suppliers, manufacturers and importers for prevailing needs and demand related to medical equipment, diagnostic instruments, drugs, personal protective equipment, respiratory assistance devices. Council of Scientific and Industrial Research CSIR said Arogyapat will become the national healthcare information platform of choice in the years to come.
In a first-of-its-kind initiative aimed at checking the community spread of COVID-19, Punjab Chief Minister Captain Amrinder Singh has launched a mobile-based app, Ghar Ghar Nigarani, to undertake house-to-house surveillance in the state till the elimination of the pandemic. The Chief Minister said it is a Health Department initiative encompassing ASHA workers and community volunteers as a tool for early detection and testing of the people for COVID-19 and preventing its community spread. Additional Chief Secretary Health Anurag Agrawal said that the entire rural and urban population of Punjab above 30 years of age shall be surveyed as part of the drive, which will also cover persons below the age of 30 having comorbidity or influenza-like illness or severe acute respiratory illness. Mr. Agrawal said this would not be a one-time activity, but an ongoing process till the containment of COVID-19. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, head of Rheumatology Department AIIMS, suggested to the people to follow social distancing, hand hygiene and cough etiquettes.
Only thing which helps is social distancing or physical distancing. Along with it, you have like hand hygiene, washing your hands very frequently, and cough etiquettes like while coughing or sneezing, just cover your face and nose. Use tissue paper or cloth, or if you don't have anything, you can just cough into your elbows. So third thing is using the face mask. For a general public, you can use cotton face mask, and then they have to be very positive. Don't give up, and surely we'll conquer over this virus.
President of Public Health Foundation of India, Dr. K. Srinath Reddy said, India is in a much better position as compared to the rest of the world as far as the COVID-19 cases are concerned, and the measures taken are yielding results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances over the next 2 to 4 weeks before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi reviews India's response to COVID-19. Increase in testing and number of beds discussed to handle the peak. Home Minister Amit Shah to meet Delhi Lieutenant Governor and Chief Minister tomorrow amidst rise in corona cases in the national capital. Loss of smell and taste added as new symptoms of coronavirus. Union Minister Smriti Irani says government is committed to the welfare of the poor, and government launches Arogyapath, a web-based solution for healthcare supply chain. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
अपने साथ अपनों का ध्यान रखो, बड़े बुजुर्गों का तुम ध्यान रखो, तो बात करो, कुछ मदद करो, कोरोना के चलते याद रखो, घर की सफाई ना भूलना, हाथों को धोना मत भूलना, सुरक्षित दादा दादी नाना नानी अभियान, अपने साथ अपनों का ध्यान.
India today said the artificial enlargement of claims by Nepal is not based on historical fact or evidence and is not tenable. In response to media queries on passing of constitutional amendment bill revising the coat of arms of Nepal by the House of Representatives, External Affairs Ministry spokesperson Anurag Srivastava said it is violative of current understanding to hold talks on outstanding boundary issues. He said India has noted that the House of Representatives of Nepal has passed the Constitution Amendment Bill changing the map of Nepal to include parts of Indian territory. Mr. Srivastava said India has already made its position clear on this matter. BJP leader and Union Minister for Women and Child Development Smriti Irani has said the whole world has been affected by the pandemic, but due to the efforts of the Government of India, the situation in the country is better than many developed nations. Addressing a virtual rally, Delhi Jan Samvad today, Ms. Irani said, during this time of crisis, Prime Minister Narendra Modi announced a package of 20 lakh crore rupees. She said the package will give new strength and opportunity to the country and countrymen. The Union Minister lauded the efforts of Delhi BJP workers who provided food and ration to crores of poor people under the Feed the Needy program during the lockdown.
दिल्ली प्रदेश संगठन के कार्यकर्ता ने राष्ट्रीय अध्यक्ष नड्डा जी के नेतृत्व में दिल्ली में 1 करोड़ से ज्यादा जरूरतमंदों तक फीड द नीडी कार्यक्रम के माध्यम से भोजन जो उपलब्ध कराया है, ऐसा कार्यकर्ता हमारा इन विषम परिस्थितियों में मां अन्नपूर्णा का स्वरूप बना है। लगभग 10 लाख मास्क मात्र देश की राजधानी में भारतीय जनता पार्टी के कार्यकर्ता ने सेवा बस्तियों में गरीबों के बीच में बांटा। 38 लाख सैनिटाइजर की बॉटल्स उपलब्ध कराई, विशेष उनको जिनके परिवारों में आर्थिक चुनौतियां थी।
Ms. Irani said the Narendra Modi government is committed to the welfare of the poor, and in the time of crisis the government provided free ration and gas cylinders so that no one goes hungry. Speaking about achievements of the Narendra Modi government in the last 1 year, Ms. Irani said after getting the people's mandate for the second time, the government resolved problems related to the unity and integrity of the country, which was going on for 6 decades. She said many important steps were taken, like removing Article 370, passing the Citizenship Amendment Act, and paving the way for construction of Ram Temple in Ayodhya.
20 करोड़ बहनों को गत 2 महीने में अप्रैल और मई में उनके बैंक के खाते में 20,000 करोड़ रुपया नरेंद्र मोदी की सरकार ने दिलवाया। उज्ज्वला योजना के माध्यम से 3 महीने तक मुफ्त एलपीजी की व्यवस्था देश के 8 करोड़ गरीब परिवारों के लिए की। बैंक चलकर जनधन योजना का खाता खुलवाने गरीब के घर तक पहुंचा। और प्रधानमंत्री जी के नेतृत्व में मातृ वंदना योजना के चलते सगर्भा माताओं को अब तक 5,000 करोड़ रुपए से ज्यादा की सुविधा कैश ट्रांसफर करके उनके बैंक के खाते में पहुंचाई।
BJP National Vice President Shyam Jaju and Delhi BJP Chief Adesh Kumar Gupta also addressed the virtual rally.
Army Chief General M.M. Naravne today said that the entire situation along India-China border is under control. He said both the countries are having a series of talks which started with core commander level talks and has been followed up with meetings at local level between commanders of equivalent ranks. He added that as a result, a lot of disengagement has taken place and is hopeful that through the continued dialogue, all perceived differences will be set to rest.
The entire situation along our borders with China is under control. We are having a series of talks which started with the Corps Commander level talks on the 6th of this month. This has been followed up by a number of meetings at the local level between commanders of equivalent rank, and as a result of this, a lot of disengagement has taken place, and we are hopeful that through this continued dialogue that we are having, all perceived differences that we have will be set to rest.
General Naravne was reviewing the passing out parade POP for the 146 regular course and 129 technical graduate course held at the Indian Military Academy IMA in Dehradun today. Referring to the situation in Jammu and Kashmir, he further added that there have been a lot of successes. In the last 10 to 15 days alone, more than 15 terrorists have been killed. All of this has been because of very close cooperation and coordination between all the security forces operating in Jammu and Kashmir. In the Union Territory of Jammu and Kashmir, security forces averted a major catastrophe by destroying an improvised explosive device, IED. It was planted by terrorists on the roadside along Bandipora-Srinagar highway near Gamru-Laudara crossing in North Kashmir's Bandipora district this morning. Officials said that a road opening party, ROP, and explosive detective dog detected the IED lying by the roadside near Gamru-Laudara crossing, following which bomb disposal squad was called in. He said the device was planted inside a gas cylinder on the roadside. It was later defused. It took the bomb disposal squad about 6 hours to defuse the IED.
People in Jammu are buying earthen pots to keep water cold. Dharamveer from Jammu has resumed making pots since the lockdown was lifted, allowing regular supply of mud for such pots. He said the profession is providing him a stable income.
जहाँ तक लॉकडाउन था तो पहले पिछले दिनों में 2-3 महीने तक हमारा काम शाम काफी पूरे बंद रहा था, तो अभी कुछ दिन से हमने काम शुरू किया है। तो हम अपने देश के प्रधानमंत्री शुक्रिया अदा करते हैं इसके लिए कि चलो उन्होंने कुछ दिन के लिए जो लॉकडाउन था और महामारी से थोड़ा बचाव के लिए हम बंद रखा था, काम शुरू किया हमने। और कुछ दिन से हमने काम शुरू किया है लॉकडाउन के बाद में।
In Ladakh, reports of 198 samples have been tested positive in a single day. This is the highest for the district ever since COVID-19 cases were reported. The Kargil District Magistrate Bashirul Haq has imposed strict restrictions on the movement of people in the whole district after a rise in positive cases in the last 3 days. More from our correspondent.
In Kargil, Ladakh, the effect of restriction on movement of people can be seen easily by the limited movement of people and vehicles in the Kargil town. The restrictions are imposed from midnight amidst the increasing number of COVID-positive cases in the district consecutively for the third day. Keeping with the recent spike in COVID-19 positive cases, Basirul Haq Chaudhary, the district magistrate Kargil, said that there will be zero tolerance against violators of SOPs and guidelines. These restrictions will continue to remain in force till 30th June 2020. The 324x7 control rooms established at DM office, SSP office, police control room, Kargil, respective SDMs, Tahsildars and duty magistrates to meet any emergency. He appealed for calm and discipline in the district. With Ramesh Chandra from Lakh, this is Anad Ali from Kargil, Union Territory of Ladakh.
In Himachal Pradesh, the state government is considering laying the foundation stones of various developmental projects online in the wake of COVID-19 pandemic. Chief Minister Jairam Thakur has said the state government is committed to the balanced and equitable development of the state with special preference to neglected areas. A report.
In Himachal, the pace of developmental work has been badly affected due to the corona pandemic and has forced the state government to reframe strategies. The state government has constituted a cabinet subcommittee and a task force to suggest steps to revive the economy of the state. The state government is also ensuring that no developmental work would interrupt due to lack of funds. Meanwhile, Chief Minister Jairam Thakur has said that normalcy is gradually returning back in the state and his government is ensuring that the pace of development goes uninterrupted. He said it was a moral duty of the state government to bring back lakhs of people stranded in various parts of the country. Sanjeev Sundaryal, AIR News, Shimla.
In Uttar Pradesh, millions of migrant workers have returned from different states during the lockdown, and the state government is now making all efforts to provide them employment closer home. Brick fields are playing a crucial role in this mission. A report.
The Baghpat district is very close to Delhi and Haryana and has seen influx of migrant workers in recent times. In Baghpat, more than 350 migrant workers have been absorbed in around 500 brick fields which are functional right now. The district president of Brickfields Association, Vikram Rana, told AIR that they are ready to absorb more migrant workers.
कोरोना वायरस से प्रभावित होकर महाराष्ट्र, गुजरात, पंजाब, हरियाणा और दिल्ली प्रदेश से जो यहाँ हजारों लोग बागपत में आए हैं, उनमें तो हमने करीब 350 लोगों को रोजगार दिया है. यदि कहीं कोई सूचना मिलती है हमें बताया जाए, हम उसे रोजगार देने के लिए तैयार हैं.
Migrant worker Riazuddin from Budheda village told AIR.
यहाँ भट्टे मालिकों से हमने काम के लिए कहा, वहाँ काम की दिक्कत हो रही थी, लॉकडाउन में फंस रहे थे. यहाँ इन्होंने हमें काम दिया, इससे हमारे बच्चों को खाने को 2 रोटी टाइम पे मिल रही और किसी चीज की परेशानी नहीं.
Currently, around 18,000 brick fields are functional in state, which are providing employment to more than 15 lakh workers, and many of them are migrant also. With Rajiv Pandit from Baghpat, this is Sushil Chandra Tiwari, AIR News, Lucknow.
Maharashtra government has reduced the rates of the COVID-19 tests conducted by private laboratories. Announcing the decision, Maharashtra Health Minister Rajesh Tope today said that the lowering of rates for the tests would provide a relief to the people. He claimed that the new rates will be the lowest in the country. The number of coronavirus cases in Maharashtra has breached the 1 lakh mark. The state not only has the highest number of COVID-19 cases in the country, but accounts for about 1/3 of the total cases reported in India. More from our Mumbai correspondent.
Maharashtra Health Minister Rajesh Tope today said that the state government has reduced the rates of COVID-19 tests conducted by private laboratories from the earlier rupees 4,500 to rupees 2,200. He said rupees 2,200 will be charged for collecting the swabs through viral transport media from hospitals, while it would cost rupees 2,800 for collection of swab from home. Earlier the charges were rupees 4,500 and rupees 5,200. Tope said the revised rates are the maximum these labs can charge. He added that district collectors can negotiate with private labs to reduce the rates further. The minister said if the private labs charge more than the prescribed upper limit, legal action would be taken against them. He said that at present there are 91 labs in the state for COVID-19 testing and about 4 to 5 are in the pipeline. Sweetie Jain, AIR News, Mumbai.
The COVID-19 cases in Tamil Nadu have climbed to 42,687 with 1,989 people testing positive today. 1,487 of the new cases are reported from Chennai. The active caseload is 18,878 as informed by the State Health Department in a media bulletin. A record 30 deaths in a single day today takes the fatalities to 397. More from our correspondent.
In view of the rising tide of COVID-19 in Chennai and its adjoining districts, the Tamil Nadu Health Department has appointed an additional 2,000 nurses on contract basis for a period of 6 months. They were posted in the government medical college hospitals designated for the COVID-19 treatment in Chennai, Chengalpattu, Kanchipuram and Tiruvallur. The move is aimed at increasing the human capital to fight the pandemic in commensurate with the increasing bed capacity in the state capital. The new appointment is set to reduce the burden of the existing medical personnel in Chennai. Jai Singh, AR News, Chennai.
Of Publications Division and Directorate of Advertising and Visual Publicity passed away after a brief illness today. A senior Indian Information Service officer of 1968 batch and wife of former CBI Director late Joginder Singh, Mrs. Surinder Kaur held several important positions in All India Radio News and Press Information Bureau. Mrs. Kaur also served as a director in the Ministry of Home Affairs. Secretary Information and Broadcasting Ministry Amit Khare has expressed condolences on her demise and said Mrs. Kaur was known for improving the working of media units in the context of government communication. Petroleum and Natural Gas Minister Dharmendra Pradhan has held a meeting with Assam Chief Minister Sarbananda Sonowal in Guwahati a short while ago on Baghjan issue. The details of the discussion are yet to be known. Now let us take a look at the weather forecast for tomorrow. The national capital Delhi will see a minimum temperature of 30 degrees Celsius and maximum of 40 with generally cloudy sky with light rain or drizzle. Mumbai will see a generally cloudy sky with heavy rain. The minimum temperature will be 25 and maximum will be 32 in the south. Chennai will see a generally cloudy sky with light rain. Temperature will hover between 29 and 36. Kolkata will see a generally cloudy sky with a few spells of rain or thunder showers. Minimum temperature in the metropolis will be 26, while maximum will be around 30. On to the north, in the Union Territory of Jammu and Kashmir, minimum temperature will be 24 in Jammu, while maximum will be around 38. The city will see a mainly clear sky, becoming partly cloudy towards afternoon or evening. In Srinagar, the minimum temperature will be 14, while maximum will be around 28 degrees Celsius. The city will see a partly cloudy sky, becoming generally cloudy towards afternoon or evening or night. In Gilgit, temperature will hover between 18 and 31 degrees Celsius with a partly cloudy sky with possibility of rain or thunderstorm or dust storm. In Muzaffarabad, there will be mainly clear sky, becoming partly cloudy towards afternoon or evening. It will see a minimum temperature of 16, while maximum will be around 34. Chandigarh will see a generally cloudy sky with 1 or 2 spells of rain or thunder showers. Minimum temperature in the city will be 29, while maximum will be around 37. In Dehradun, temperature will hover between 25 and 33 degrees Celsius. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi reviews India's response to COVID-19, increase in testing and number of beds discussed to handle the peak. Home Minister Amit Shah to meet Delhi Lieutenant Governor and Chief Minister tomorrow amidst rise in corona cases in the national capital. Loss of smell and taste added as new symptoms of coronavirus. Union Minister Smriti Irani says government is committed to welfare of the poor. And government launches Arogyapat, a web-based solution for healthcare supply chain. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the evening news. Good night.